It's Thursday, March 5th, and time for your Barbados Today morning news update. The prevalence of non-communicable diseases has exceeded the national health budget and could cause significant financial problems if not urgently addressed. The warning from health authorities, who say issues of childhood obesity must remain at the forefront, even as major focus was being placed on protecting the country from the coronavirus. Addressing the Barbados Childhood Obesity Prevention Coalition Media Conference held at the 3Ws Oval yesterday in recognition of the first Unified World Obesity Day, Clinical Director of the Barbados Diabetes Foundation, Dr. Diane Brathwaite, painted a picture of crippling costs confronting the healthcare industry.
What's happening is that we have a tidal wave of NCDs. Is causing premature complications, and it has simply outstripped our healthcare budget. It's as simple as that. We will not be able to continue to cure for the number of complications that we're seeing. And while it's important to cure for complications and people with active disease, more effort needs to go into very focused and targeted preventative measures, education, supportive policies, etc. So now I get to jump to sugar. And not sugar diabetes. I work with diabetes, but I'm talking more about sugar as in sugar that we eat as opposed to diabetes. But let me make reference to diabetes. If you have diabetes, the cost of your medical care is actually 6 times that of somebody who does not have diabetes on an annual basis. Should you develop a complication of diabetes, your costs can escalate to a spiraling 60 times the cost of care for somebody who does not have a complication related to diabetes. And the same applies to the other NCDs and the complications related to them.
Meanwhile, Chairman of the Barbados Drug Formulary Committee, Dr. Kenneth Connell, has applauded the government's effort to limit the impact of the fast-spreading coronavirus. However, he said NCDs should remain a top agenda item.
As countries and organizations work to address the threat of the coronavirus, it is important to note, however, that the NCDs, while they are unique and much slower pace, are constant and consistent, and they don't exist in isolation. For instance, the WHO has declared that people who experience NCDs are at higher risk from any viral infection, including coronavirus. Individuals with NCDs therefore need to pay special attention, even more so today. Our Childhood Obesity Prevention Coalition represents a range of civil society organizations which have joined arms to highlight to the government that the people of Barbados want to see strong and swift action taken against childhood obesity and the NCDs.
Stiffer laws are coming to bring order to the water sports industry. The announcement from Minister of Maritime Affairs and the Blue Economy, Kirk Humphrey, during yesterday's estimates debate. Humphrey said his ministry has met with the Coast Guard, maritime operators and other sector officials about the legislation, which he said would soon be before Cabinet for approval. He revealed that Carlisle Bay would also be designated as a marine management area to help regulate the sector, with operators required to sign in and out.
But once we start structuring it, where you have to come on mornings, give us your name, report your jet ski. I mean, we have to put the structure in place, and I am hopeful, and the CTO knows, but I'm hopeful that in a month, at most 6 weeks, I will be in a position to bring this to Cabinet with a definitive position as to exactly how it is going to look. But most of the groundwork has already been done. The Coast Guard is involved, the Marine Police is involved, the jet ski operators. We had a meeting with the BHTA, so they're also involved. We brought all the stakeholders into the conversation. But bringing discipline to that space is perhaps one of my more pressing concerns. So we will have it resolved in short order.
A new UN women's study raising serious concerns about violence against Caribbean women has urged governments to make the issue a high priority. The study, based on 5 Caribbean countries, showed that as much as 55% of women between ages 15 to 64 experience some form of gender-based violence. It further revealed that the majority of these cases go unreported, mainly due to a lack of confidence in law enforcement and justice systems.
We have to position intimate partner violence and gender-based violence as a national security issue, as an issue that's not just for to be addressed within the home, but it's a public, an issue that should be tackled in all spheres. So I think that requires a change in mindset at different levels, at the personal level, right, where we need men and women to engage in relationships that are mutually respectful, and so that way, when violence occurs, you know that you're crossing a red line, right? At the societal level, at the community level, we need to work with NGOs, we need to work with, all young people. We need to look at what I call the centers of socialization.
Barbados was not included in the study, which featured Guyana, Jamaica, Trinidad, Grenada, and Suriname.
There's regional and international news after this short break.
It's Festive Friday at the Bridgetown Night Market at Pelican Craft Center. Kick off the weekend this Friday from 4 p.m. to midnight with loads of food, drinks, and entertainment. Get ready for Crop Over with the Rhythm Root Street Parade. Party like it's Kadooman Day on the street around Pelican Village with costume reveler, music, and more. It's Festive Friday. It's Festive Friday at the Bridgetown Night Market at Pelican Village Center from 4 p.m. to midnight. Admission free.
Regionally, the United Nations launches a humanitarian response plan for Haiti for the year 2020, following what it says was a very serious political crisis, combined with a socio-economic crisis stemming from 2019. The UN's resident humanitarian coordinator Bruno Lamaki launched the initiative in Washington yesterday.
The plan as such is targeting the most vulnerable, which is 2.1 million people, which is about 1/5 of the Haitian population. It will have 4 objectives: to save lives, respond to urgent needs, to continue strengthening the country preparedness to disasters, to protect the most vulnerable, and to contribute to the elimination of diseases with epidemic potential.
Finally, the International Monetary Fund and the World Bank Group announced additional measures to curtail the impact of the coronavirus on the world's economy and health. The financial institutions announced that over $60 billion in resources would be made available immediately to member states. The IMF also has $10 billion on hand to help low-income countries.
We do have up to $10 billion available for low-income countries to tap in with zero interest rates. And obviously we would prioritize countries, especially countries in Africa that have already been faced with difficulties. What is hugely important today is to focus on building a bridge between where we are and that time when we would see a recovery, to make sure that the impact in meanwhile is softened first and foremost on people, and also, of course, on businesses and the economy.
And that's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.